I also thought that if I was going to be involved with this, that we had to do this in an investigational manner, and that every patient that we treated would enter into a study where we could assess the treatment for ourselves in our own hands to see how effective we were doing our CCSVI treatment. And so we have organised this study. It's in association with the Multiple Sclerosis Research Centre. There is a neurologist who is very helpfully providing advice for us, and we've just begun this in the last couple of days. It's a feasibility study, and for me that means, are we able to do this safely, and is it something that we can continue to do with good results? We're doing neurological assessments to provide for us the information everybody here wants to know. Is it effective? And this is then going to provide us with the experience that we can participate in something that's not yet happened anywhere at all, a trial. And that's to randomise patients to no treatment versus treatment in a random fashion, and see whether the patients have been treated have indeed had benefit. Tom said earlier, I might make a comment, that it would be foolish for anyone who is beginning treatments to suddenly randomise himself or the procedure against no treatment. Once we've gained some experience, then I think it would be appropriate for us to participate in the trial. And one of the best things about yesterday has been the linkages of other doctors involved with us around the world. And we are planning to participate in that way. I'm nearly over, regarding treatment assessment, and because it's slightly different, for about a dozen years I've been using intravascular ultrasound. Now, ultrasound was introduced into clinical medicine by an obstetrician here in Glasgow, Professor Ian Donald. It's now been miniaturized to this little gold chip, which is a catheter which can be fed over the wire up into any artery or vein that you want. And I've been using this because of the endovascular procedure. And on the left-hand panel you can see the blood supply into the brain. This is a carotid artery. And you can see, if I just point to it here, this very, very tight narrowing in the internal carotid artery, which is the main blood supply to the brain. The middle two circles, yeah, I just didn't think it was lasering very well. Okay. The middle two circles here are the intravascular ultrasound images. And you can very elegantly see the lining of the healthy artery here with this thin intima and media and adventitia, the three layers of the artery. And then this crescent moon-shaped bit of a little bit of disease at this level here above the narrowing, but in the middle of the narrowing, very tightly down. This is the lumen of the artery here, and the rest of it is the disease. And this is just a kind of pullback of the images. So I wondered if we might be able to do this in CCSVI treatment too, because it also provides a fabulous view of the completeness of treatment. IVUS intravascular ultrasound assesses the severity of the disease and then the completeness of treatment. So I'm going to try to, if you'll let me, show you a case that we did just to indicate to you how helpful it could be. The big panel on the left, can we maybe put the lights out? Can you do that? The big panel is just this is the jugular vein. This is the white edge of the jugular vein. The red is blood. And the black circle in the middle is the catheter, this tiny little catheter going up the jugular vein. In a patient with multiple sclerosis and CCSVI positive being treated, and we've pulled the catheter, this is the catheter here in longitudinal reconstruction, down through the lesion. You can see the pulsation of blood is not as great as in the arteries, but as we come down, I want you just to see the narrowing on the middle panel as well as in the one on the right. If I just drag this back up, you can just see how tightly narrowed. Remember the size of that little catheter I showed you is this black circle here. So, I'm hoping that we can use new technology to try to see if we can do this better. My last comment really is that in speaking over the last year with Eva Petrov, I am very keen that we progress this treatment, but with an investigational study, and that we introduce it in a careful way that people do it well. I don't want to see a new treatment with good potential being done by people who haven't learned it properly. I think one of the most important things about yesterday's meeting was to try to get people together to make sure that we are doing it as well as possible, and that anyone that wants to start to do it does it as well as possible. I think I would lastly like to just summarise and end the whole session by thanking Tom Gahuli for arranging not just today, but yesterday, which was a remarkable thing to bring everyone from all over the world to begin something I hope very helpful.